So if you could start by telling us how old you are, how tall you are, and how much do you weigh?
I'm 25 years old, I'm 5'10", and I'm weighing about 197.
And how old were you when you first noticed there might be a problem?
Probably when I was in high school. I noticed that my nipple is bigger than the other one, and I started to feel pain every time it rubbed against my shirt and stuff.
We are 1 day post-op, a little less than 24 hours. We did not do any liposuction for him. We just did the gland resection. What do you remember from yesterday? Do you remember arriving at the office?
Yeah, I remember arriving to the office, getting really nervous, and I noticed that the medication that you gave me wasn't really kicking that much, so I asked for more. And then once I laid down, I started to calm down a little bit. I felt the initial pinch of the syringe, but after that, I didn't feel any pain after that. I remember laying down, right, and I just started singing out of nowhere.
Oh, you remember that?
Yeah, I remember that. But from there, I remember everything was done. I got up. I couldn't really walk properly. I was pretty dizzy, and that was about it. That's all I remember.
This morning we're doing a case of unilateral gynecomastia surgery on this young gentleman. So he's in great shape. He said that he first noticed the gyno on the left in high school or middle school, and it's persisted over this time. So if it hasn't gone away in more than 2 years, it's likely not going to go away. And you could see the difference between his right chest and his left chest. He's very muscular, so you could see the lateral, inferior, and medial margins of his pec. But on the left side, you could see how it's asymmetric. This side is kind of drooping down a little bit. And he pays a lot of attention to his body, so he notices it. Random people might not. But when you're up close, especially if you palpate, you could feel a mass about the size of like a grape right there. So that's gonna be the target of what we're gonna remove. For him, his body fat percentage is too low to do liposuction, not because we couldn't, but because the chance of creating a contour irregularity is too high. And so what we're just gonna do is we're gonna numb up the area, fill it full of fluid, and we're gonna carefully dissect out the gland itself. We're gonna make our typical incision from the 3 o'clock to the 6 o'clock point. We're not gonna make an axis in the armpit. And let me mark out where the gland is. So we do our marking by making the sternum, the sternal notch, the 3, 9, and 6 o'clock positions. We go across and arm up. And then the border of our anesthesia is going to be at the inframammary crease. And as I mark it out now, you can see how it's lower on the left as compared to the right. And then the superior border of our anesthesia, so if I palpate the mass again, and if he flexes his pec and relaxes and flexes, it's about right there. And relax and flex again. So that's the border of the anesthesia, but the actual mass itself, we call the middle the body. As we go laterally, we call that portion of the mass the tail. So typically, the gland is longer than you would expect. And the medial portion we call the head. So as I feel it out, I think that's about the margin of the gland. You'd be surprised. Once it comes out, I think it's going to be bigger than what you would think. He's going to be able to hold it, so we'll see by proportions. But that's our operative plan. He's been medicated. His vitals are good, and we're going to get the case started in just a moment. And so you had a little bit of nausea and vomiting yesterday. Do you get typically nauseous, like if you're on boats or?
Yeah, I get seasick.
And in terms of the pain of yesterday, would you say that it was a very painful day?
I wouldn't say it's very painful. It was just very nauseous and dizzy.
So this is the first surgery of your whole life.
Yes.
In terms of like experiences and like what you expected surgery to be, other guys who have gyno or are considering surgery, if they were to ask you like how painful it is or how scary the experience was, like any words you'd have to them?
I mean, there's nothing to be afraid of, you know. I thought I was gonna be awake the whole time and then watching them, you know, do all the surgery and stuff, but really you just fall asleep. You don't feel no pain at all. You'll just be fine.
So the only minor complications I'd say that we had in this case is, you know, some post-op nausea, vomiting, which is to be expected after anesthesia. Number two, there's a little dark spot at probably the, I want to say the 10 o'clock position of his areola. So I would call that ischemia. So the blood flow is a little bit compromised. If we're completely compromised, it'll progress to something called necrosis, which I don't think he has. The reason why I think that is that number one, it's getting better. Number two, it's not particularly painful. And for issues with ischemia, you're at the highest risk if you're a high-risk candidate for surgery, older, diabetic, medical problems. In his case, he's as young as healthy and could be, so these issues typically resolve extremely well. He's gone through the hardest, most anxiety-provoking part of this whole process, so hopefully he'll send us follow-up photos so we can follow his recovery. But the biggest part of his gyno journey is now over. Congratulations to you, sir, and he can move on with his life.
All right, thank you.
When did the word gyno ever pop in your radar?
When I started bodybuilding, I asked some guys that I knew that why is one nipple bigger than the other one? How come I can't remove that fat? And they told me that it was gynecomastia.
And had you ever been obese?
No, never. I grew up really skinny.
And how old were you when you started getting into bodybuilding?
Back in 2021, so 21 years old.
So now being 25, first noticing it when you were a teenager, has it been getting worse or it's been about the same?
It gotten a lot worse, a lot bigger. The pain got a lot worse too.
And had you ever used anabolic steroids?
Yes.
And how old were you when you did when you first tried anabolic steroids?
When I was 24.
And is that the time that the gyno got worse?
Yes.
And were you on tamoxifen or any of those other medications to kind of prevent gyno during the cycle? Had you been using them at the same time?
Yes. I switched to Caber. Caber worked a lot better, but I still had that gland in me. It wasn't as fat, but it got a lot smaller.
Okay, so the medication did help to shrink it a little bit?
Yes.
So at the time we saw you yesterday, it's smaller than the biggest it had ever been, the gland?
Yeah, no, so what you saw yesterday was the biggest it's ever been.
Okay. Yeah. And in the past few months, have you continued on tamoxifen or any other medications to modulate the size of the gyno?
No, because I knew I was going to come here and get it removed.
Okay. Do you know anyone that's ever had this surgery before?
Yes. Yeah, a couple guys at work.
Mm-hmm. And they just had gyno, but they never had the surgery?
They had gyno and they did the surgery.
Okay. We checked with the ultrasound today and we really didn't notice any significant fluid pocket. I did show him the technique to do the needle aspiration. He's an out-of-town patient, so I gave him the supplies to take home. Do you feel pretty comfortable that you'll be able to do the needle aspirations?
Yeah.
I said that the area would be numb and you wouldn't feel the needle going in. Did you feel the needle going in?
No, I didn't feel anything.
And so you're a young guy, so you haven't had that many years with gyno. Like, you did a good job just getting rid of this early, not living with it for your young adult life. Having it, did it impact anything, clothing choices, pool parties, going to the beach, taking your shirt off?
Not really clothes, but more like going to the gym, going out in public without a shirt. Because I felt like people would like see the gyno and then judge me. Even though I ask a lot of people, they tell me that they don't really notice it until I tell them. But I still feel really insecure about it.
Do you see yourself being more willing to be shirtless now that it's gone?
Oh yeah, most definitely. Because I plan on competing in bodybuilding, so I feel more comfortable taking off my shirt, doing my poses that I need to do.
Okay. All right. So for the people coming behind you, knowing what you know now, having gone through the process, is there any words of wisdom or general comments you'd make to anyone going through gyno?
If it's really causing you problems, I might as well get it removed. You don't want to live with that type of pain or that insecurity all your life. Just get it removed.